Good morning, everyone. Good afternoon, good evening, depending on where you are at. Thank you so much for joining us today. I was a little late jumping on, so I didn't get a chance to say to our panelists and speakers for joining us, but thank you so much. And I'm so looking forward to the conversations and learning that we're going to have together today. My name's Amy Robichaux, and I'm the CEO of Mothers Matter Canada. Um, I am thrilled to welcome everybody today to this event. Uh, and I'm thrilled to welcome everybody today to this event, which we've titled A Transformative Approach to Challenging Gender-Based Violence, Engaging Men, Centering Care, and Building Accountability. Before we get too far into the substance of today, please note that Zoom captions are available and can be set to your preferred language for a more accessible experience. And I encourage you to have active conversations ongoing in the chat throughout our event today. Thank you for joining us today. Mothers Matter Canada is located and headquartered in the ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh peoples and nations. And I am so incredibly grateful to be able to live and work and care in spaces that have been cared for since time immemorial. The cultural traditions of the First Peoples of the place where I live and where MMC is headquartered are based on matrilineal societies. And it is that care and that acknowledgement of everybody who is with us, either being mothers or the children of mothers, that we work to reestablish and reemerge in terms of how we think about our cultural understanding of care, of motherhood, and of gender in Canada today. And we do that in a variety of different ways, but primarily Mothers Matter Canada develops proven programs and then partners with community organizations across Canada to lift mothers out of poverty, isolation, and need. And when we lift mothers out of those things, we lift families too. We design with mothers, we pilot with communities, and we scale through partners by training their staff and providing every tool they need and supporting them every step of the way. Our work is grounded in research, evaluation, collaboration, human dignity, and advocacy, because we believe that no mother, no child, no family or community should go without the tools that they need to thrive. Today's event that you're joining us for is the culmination of 2 years of developing the Men Like Me program. Through funding from Women and Gender Equality Canada, we've explored how to engage newcomer and refugee fathers and men as caregivers, allies, and partners in preventing gender-based violence. The prototype Men Like Me program was tested by community partners in Edmonton, Regina, Saskatoon, Toronto, and Yellowknife, working with nearly 200 fathers. The results of this prototype and testing and 2 years of work is a program that has proven results. Men, when given the opportunity to come together in safe and supported spaces, are eager to connect, to reflect, to learn, and to grow as allies and interveners to prevent violence in their communities. The work put in by the fathers in the Men Like Me program created ripple effects across families and communities. It strengthened healthy relationships, advanced gender equity, and increased everybody's sense of safety and belonging. So, as March draws to an end, so does the month that we honor International Women's Month. And we couldn't think of a better way to conclude these days of work on our end by showing up for women and for work that advances safety, equity, and dignity in our communities. So once again, thank you so much for joining us. Globally, we know that women carry more than 3/4 of what we often call invisible labor. This includes caregiving, household responsibilities, emotional labor, and maintaining family and community connections, the management of healthy social and familial relationships. This is the case not because men don't care, but because the same systems that put women into caregiving and nurturing boxes have put men into a man box, where the only emotions that are encouraged are anger and stoicism, and the only behaviors that are encouraged are to be isolated, to not ask for help, to provide, and to not show weakness or be overly emotive. While we know all too well the devastating costs and consequences of gender-based violence for women, and we can clearly name the social injustices that women face, the victim blaming, refusal to believe them, the burden of protecting themselves and other women. We have spent as a community and often as activists a lot less time on understanding and addressing the roots of violence in men, the isolation from themselves, from each other, the social and cultural expectations that they have to prove their value and worth consistently, and without the assistance of others or showing anything that could be considered weakness. At Mothers Matter Canada, we believe that preventing and, frankly, ending gender-based violence requires collective responsibility. We know that it's going to require men and boys to be engaged as partners in change. And so it also requires that men and boys have access to tools and supports to break out of the box that they are all too often put in by the very same system, the patriarchy that traps all of us, men and women alike. Dismantling it, creating safe and thriving communities made up of individuals who are equal in dignity and opportunity is only going to happen if we all insist on it. And frankly, if the work of our panelists, speakers, and attendees today continues. So, today's event is designed to explore the concept of care as a core strategy for violence prevention. Together with each other, we're going to explore how men's engagement as caregivers, allies, and true social and familial partners can shift not only interpersonal relationships, but also entire norms within communities, organizations, and how men view and relate to themselves. We're going to draw on the knowledge and insights from absolutely phenomenal leaders of community initiatives and global initiatives, people who are way smarter than me. So I'm going to be quiet in a minute, um, that promote healthy masculinities, equitable caregiving, and the shared social and familial responsibilities. As all of us learn from our panelists together, I want to invite us to reflect on what it means to center care in our collective work, but also in our individual efforts to prevent gender-based violence and to create a more equal society free of the patriarchy and free of violence against everybody. It is my absolute pleasure now to welcome Amy Jo, one of my colleagues at Mothers Matter Canada, and really our operational powerhouse behind the Men Like Me prototype to moderate today's first panel. Amy, over to you, and I look forward to meeting our panelists.
Thank you so much, Amy. I couldn't put it any more clear in the chats. Someone said that what you said was super powerful, so thank you so much for your opening remarks, Amy. My name is Amy Jo. I am a project coordinator at Mothers Matter Canada. In my role managing the Men Like Me pilot program, I've witnessed the transformative impact of the program and how it builds healthier families and opens up space for men to engage with their mental health and the people closest to them. This is really meaningful to me because I know that there isn't that much space for men to open up. So it's always heartwarming to see that we're able to provide this space for them to open up and for them to engage in really meaningful discussions about their families, about what it means to be a father and a healthy partner. So I'm very pleased to moderate today's panel, The Hidden Frontline, Caregiving, Masculinity, and Violence Prevention. This discussion centers care as a key strategy for preventing gender-based violence. In Canada, GBV continues to disproportionately impact women and girls, particularly newcomer refugees and those in rural communities. Unequal caregiving responsibilities and invisible labor, most often carried by women, are rooted in harmful gender norms that can create power imbalances and contribute to violence. This is why prevention is essential, and engaging men meaningfully to care is a part of the solution. By supporting men to engage as caregivers and allies, we foster empathy, compassion, and accountability. As a result, we do see stronger families, healthier communities, and a reduced risk of violence before it begins. Today's conversation draws on Canadian community-led experiences and frameworks that promote positive masculinities, equitable care, and shared responsibility. And I'm joined by our change makers here today who've been instrumental in transforming the gender-based violence space. I'd like to start with a moment of connection with everyone here. So we'll share the panelists' biographies in the Zoom chat, and I would like to ask everyone in the chat also to answer the same question. What sparks joy in the work that you do? So for everyone in the audience right now, please feel free to pop your answer in the chat as well. I'm going to start with Tony Porter. What sparks joy in the work that you do?
Well, good afternoon, everyone. Good to be here. I appreciate you all having us. When I say us, myself, a call to men, and everyone else that's here. What sparks joy in the work that I do? Well, you don't get a lot of instant gratification in many respects, but I think what really sparks joy in the work I do is when I'm spending time with boys and they get it. Amy talked about the man box. We do a lot of exercises with boys around the man box, and I love when boys quickly get it. When we create space, and I think I already heard that mentioned also, when we create space, men will get it. They come into that space, they quickly get it. And I love to see that, and when I'm experiencing that with boys.
Thanks, Tony. I love that answer. For people in the audience, Tony Porter is one of the speakers that has popularized the man box, which so many gender-based violence programs use across the world globally. And it's really a reference in the box of stereotypes and gender norms that men and boys are really confined to. So it's amazing to hear that with your exercise, boys and men are also able to explore like what other areas they want to really be in and maybe not being labeled at all and just finding themselves without the stereotypes attached. So thank you, Tony. And next, I would like to go to Yusra. What sparks joy in the work that you do?
Thanks, Amy. What really sparks joy for me is the resilience piece, because whenever we talk about GBV, we're always looking at, victims, and the stories are incredibly sad, and the realities are very hard for people to navigate, especially mothers and families when children are involved. So what sparks joy for me is that with very little effort, especially in prevention mechanisms, there's a lot of resilience in families, in parents, in mothers, in women, that they use that support and they make sometimes, you look at the support that you gave and the scale of that support, and you see what they make of it, how they make it into an opportunity to reintegrate, to get their life and the life of their children back onto the track. So that resilience piece is what ticks me and brings me most joy.
Thanks, Yusra. I love that feeling of that experience piece. And it's different because you come from working with women mostly, and you really empower refugee and newcomer women in our field. So this will highlight a great contrast between the men's programming and also your previous experiences as well. And I would like to also ask Jake Sticka, what sparks joy in the work that you do?
Feel this will probably happen a lot, but privileged to riff off of Tony and shout out to the Man Box. It got me thinking about how we collaborated with Equimundo to create a game on Roblox called Unlock You, and we work a lot with middle school age boys, and the goofiness that they have, that kind of innocence of the man box closing in on them, the before that happens, that's such a beautiful time to be working with them to challenge and change some of those ideas. Another space where I love listening to our team do that work is the Breaking the Boy Code podcast, where we talk a lot about young men, but in that podcast, it's co-hosted by the next generation of men, and you get to hear what's going on for them. So always, I think, the young people are inspiring and spark joy.
Thanks so much, Jake. And Jake mostly works with young boys to empower them with positive masculinity. And I find that super cool that you created a Roblox game, because what better way to engage youth than in Roblox? I keep hearing Roblox concert, Roblox movements. Like, there's so many universes within Roblox that it's amazing to see that you can really influence them in a positive manner. So thank you, Jake. And I see so many wonderful responses in the comments section too about people making differences and supporting men's courage and vulnerability and connecting with others. So thank you everyone for also responding about what sparks joy in you. And I will say that today we do have another speaker, Farrah Khan. She's not here with us right now, but we can incorporate her into the webinar once she does come on. I would like to just thank everyone again for telling us all about finding pieces of joy in your work. And I'm so happy that everyone here carries diverse programming and project experiences. Having worked in gender-based violence for many years for many of you, we see that the bulk of caregiving and invisible labor is carried by women. So my question to Jake first is, if we center caregiving and invisible labor in our understanding of gender-based violence, how does that change the way we think about prevention and the roles men can play as partners, fathers, and allies?
Yeah, I think like care is such a powerful phrase in flipping the conversation in a way. So much of the gender-based violence prevention conversation is almost always about what men need to stop doing, right? But when we give them a word like care, it gives them something to move toward, which is fundamentally a different motivation. And it works better with a lot of the populations that we serve. We see groups that are very resistant to conversations around violence prevention, but when we frame it around the entry point of being the best father that you want to be, about being a good partner, showing up for your community, it's the same destination of preventing violence, but a different on-ramp into the conversation. And boys who grow up seeing men in their lives as caregivers have a different template for what masculinity looks like. And what's really exciting for me as well too is knowing that my cohort of fathers, I'm in my late 30s, millennials, they're 3 times more engaged than generations prior in caregiving and fathering at home. And I'm really excited to see what it looks like in 15, 16 years with the generation growing up with those types of caregivers at home.
Thanks, Jake. I really like that you mentioned um, kids are very easily influenced by who does care for them. So, a boy with a very involved father taking on the caregiving, the shared parental responsibilities, does also grow up to have these characteristics or traits in them to want to also care and also contribute to parental responsibilities. And like you said, a lot of the time in this work, a lot of the blame has sort of been shifted towards men, but this work that we do is really about just encouraging them to be in this space, not really scaring them away, but involving them in wanting to care. So thank you for that. Tony?
Yeah, and Jake, it's good to see you, man. It's been a minute. I hope all is well. Uh, when I was listening to Jake, it made me think of a social media influencer that I'm connected to. His name is Kid Gaines, and he shared about, and he's about Jake's age, and he shared about men before him, the generation of men before him, which is my generation of men. And he said those men didn't know warm love. I had never heard the term warm love used before, and I probably wouldn't even have understood it if it wasn't in the context of the conversation we were having. But yeah, I love that term. I fell in love with it. Warm love, right? And so, And having been doing this work for a generation or so, I've been blessed to really see younger men starting to embrace that concept of warm love. And when we're talking about child care, it it requires we as men to move away from what we love to do, which is coaching, right? We love coaching, particularly. And when I'm saying coaching, I'm really talking about sports. We love coaching. We love that level of engagement with children. But it's the nuances of nurturing. That's where we get twisted up, right? And that's that warm love, because when you're talking about nurturing, now you're talking about empathy, you're talking about patience, you're talking about caring, you're talking about tolerance, you're talking about kindness, active listening, all of these characteristics of nurturing that we would want to believe that women just innately do. And I'm not going to say there's not a degree of that, but it's more about socialization, right? We're not socialized as men to nurture. And when we do, and this comes back to what you shared, Amy, when we do, our children are the better for it. Both boys and girls, they're the better for it when we can show up in spaces that way as men. And I love younger men like Jake who are modeling this for the next generation, right? But that warm love, I've held on to that term, and you make me think of it now.
Thank you so much, Tony. That warm love can never be replicated or replaced by technology. So this is really core to the work that we do. It's all about humanity, compassion, and empathy in encouraging people to have positive behaviors. You can't get places if you're not using this warm love that you're talking about. And it's so important in fatherhood and motherhood. That piece of warm love and courage and cultivating love in this relationship. So thank you so much, Tony. Yusra?
Thanks. Really loving the inputs from Tony and Jake, but I'm going to dig into the intersections of caregiving and invisible labor. So I think when we center caregiving and invisible labor, we fundamentally shift how we understand gender-based violence. And it's not an isolated incident anymore. It's a system of unequal power that shows up every single day. So it's not an incident. It's about who carries the mental load, who absorbs exhaustion, who gives up income, who manages children, elders, appointments, meals, emotions, and recovery, often without recognition, compensation, or rest. Amy this morning said 1 in 3 women experience violence globally, and we know women do almost thrice as much unpaid care work as men. These are not two separate realities. For me, they're very deeply connected. When care is unequal, power is unequal, and that's a starting point for prevention. Centering care makes us move away from questions like how do we respond once violence has occurred, but also ask different questions like what family, workplace, and community conditions normalize entitlement, dependency without reciprocity, and women's overfunctioning. What are men and boys learning when they see care treated as women's duty and men's help as being just optional? It comes back to the socialization piece Tony was talking about. And really at the core of it, what are men being denied when masculinity is defined by distance from care rather than responsibility within it? So as a cisgender woman on the panel, I'd say that unequal care is one of the most everyday ways that inequality is organized and reproduced. And when we change the lens, when we shift it, men are not bystanders, right? Like with what Jake said and what Tony said, men are part of the architecture of prevention and response, like they are part of the architecture of societies, communities, and homes. So as partners, it could mean sharing the daily invisible work that sustains life, sustains the economy, sustains our day-to-day functioning as fathers. It would mean modeling, nurturing, regulation, respect, and taking accountability for the children, especially boys, because of the role modeling piece, so they can see and feel the warm love and they are able to give that on to the coming generations. And as allies, it really means challenging the norms that reward dominance and excuse disengagement at home, at work, and in public life. So it has to be very community driven. It will be most effective when it comes from peer, from men. I'm going to talk a little bit about our Men Like Me program that was funded by Wage, the project that's brought us all together today. It was prevention was sandwiched in parenting supports and caregiving, and we saw fathers spend more than 3,500 hours with their children. And we saw from fathers' responses that caregiving shifted from obligation to connection. And that's when they self-reported that they are, from 39% to 85% more confident in caregiving and providing for their families, because they felt like they were at the center of it. It's as much for their children and for their spouses as it is for them.
Thanks so much, Yusra. Um, it is really important to mention the invisible labor of it all. As this panel mentions, like most of the caregiving in the world is coming from mothers and women, and even in so many community-based areas, the women are taking on the load of making the community happen. So it's important to recognize the invisible labor that goes behind it all. How much money it would really cost if we were to compensate this caregiving piece, but also the really pivotal importance of involving men again, involving men on taking this caregiving load. And thank you, Yusra, for highlighting the Men Like Me program too, because it is a really impactful program. And I would like Farrah now to also answer the question of what sparks joy in your work, as well as thinking about prevention and the roles of men or other genders can play as partners and as allies in the gender-based violence space.
What sparks joy right now for me is being here. I love these kind of conversations, and my apologies for being late. I had a health situation that I had to attend to. So I think for me, when I think about caregiving, I think about my own just experience. Over the past 3 years, I've been in having to receive care, which really sucked. I didn't want to from the community around me because I was going through cancer's treatment. What was interesting was that when I put the call out for the care team, the people that answered were women, even though there was a lot of men on that list. But it was the women that showed up to my appointments. It was the women who offered to drop off food at my house. There was one man, and he's actually here, Todd, who, sent a food voucher and just said, like, I know it's hard to cook, like, here, this is for you. But it was very interesting to me about that happening. And I think when we talk about care, we have to not just like invite men to, we have to expect them to. So, I have a 6-year-old son who we talk a lot about caregiving because as parent, my spouse is non-binary and I'm cisgendered, but we are two non-cis men. And, and then we have this little guy right now that's like, we're doing all these things for, and, making sure from the start that he understands that empathy is a part of how we build, that community is a part of what we do. And so, can it be from talking to him about why we volunteer, why we do those pieces. I think it's also looking at our how women show up for each other with gender-based violence. I've been working in this field for 25 years, and what I see time and time again, it is women showing up for each other, be it, I have 2 bags of milk that I got from the community kitchen. Do you want one? Do you, want me to take care of your kids so you can try to get some work today? I think often we don't recognize that invisible labor of the ways in which women have kept each other safe and the ways in which we need to put more expectations on men around that it shouldn't just be women, that they should be aware. One way that we've been doing that at Possibility Seeds, and I built this out when I was 18. When I was 18 as a survivor, I started doing punk rock shows in the basement of churches with my friends to fundraise for rape crisis centers. And I would take the mic in between sets and talk about sexual assault. And one of the things I talked about was how we needed to show up for each other, knowing that 98% of young people do not report dating violence. 98%. And that's higher than the national average around who reports sexual assault. And what I did is I developed this thing called the BRAVE model, and it's literally learning how to show up for each other when you disclose. And it's about emotional labor, and it's about caregiving. And if we want people to have that skill, we have to decenter it from the idea that it just is something natural that women can do and should do. And it's something that all of us should do as a community. And that community care, showing up for each other, is a way that we show love and kindness, but it's also a strength and it's a leadership piece. So this model, I've trained over 100,000 people in this model, and it's really simple, but it's really like begin by listening, respect the confidentiality, ask what support looks like, validate them, have empathy for yourself and them. And what I find time and time again is that there is trepidation when I come into a mostly male space. Like, so when I come into some union spaces, I'll be told, they won't, they may be really pushed back on this. And then once we start talking about it as a form of care and how we show up, that shifts the language. So I think caregiving from a place of how we build GBV how we end GBV is core. It's just core of how we do this work. And that's what sparks joy for me. The idea that we understand as a community that this is how we take care of each other, that we all matter. And that it's not the expectation. Sorry, it's the expectation, not an invitation anymore. I expect that.
Thanks so much, Farrah. I also would love to expect for men to do a lot more in terms of caregiving, and I'm grateful that everyone here on this panel is able to share their stories of men contributing more of caregiving. And even Jake had mentioned Todd also provided him a voucher after his surgery. So that's so amazing. Thank you, Todd, for really like stepping up and showing that you care. And as the audience also pointed out, there's so many different ways of showing up for the people that you care, of building community, whether it be plowing driveways for seniors or giving meal vouchers. These are all incredible ways to show up. And I really love that we're building this community of care. So I wanted to ask now, starting with Tony, from your work across communities and sectors, what approaches have been most effective in engaging men and boys in equitable caregiving and violence prevention, and how do cultural and community contexts shape what works? So feel free to talk about the demographic you serve, the geographic locations. I know it varies from geographical location and definitely
Yeah.
the ages as well.
Okay, great. One quick second before I go there. I'm still resonating with what the two sisters shared, and particularly when Yusra was sharing more about systems that are in play and how they play out. It really makes me think about the issue of value, because so much of what we're talking about is rooted in how we are collectively socialized in a male-dominating society to have less value in women. So when you look at what's been traditionally defined as women's work, which in essence is taking care of people, right? If you work in childcare, it's one of the lowest paid jobs that I know here in the US. One of the lowest paid jobs would be childcare. Teachers, as important as they are, taking care of children, another lower paid job. Human service providers, right? Those of us who do human services, you need to have 25 letters after your name, which all costs money and still a lower paid job, right? Police officers are actually a lower paid job, but it has the sense of power. And that's why you'll find many men there, because you have a firearm and all that comes with those privileges. But again, that's also a lower paid job. But if you look at all of the employment here in the US that's designed to take care of people, is largely women providing those services and lower paid jobs. The entire field of social work, lower paid jobs. And when you find, I always is always interesting when you ask a white man who's a social worker, what do your friends, and I'll say why I say white men, what do your friends say about you being a social worker? Other white men would really question him as to, and I'm sure Jake answers a lot of these questions. Why are you doing that? We're socialized to have a lack of interest in all of these spaces. So it lends to the question for men, why are you doing that? Now, with black and brown indigenous men, we're so happy you have a doggone job in this society. We'll take you with a job, period. But white men in particular, in a society that has been designed for them to dominate and lead and have plenty of access, they will be questioned when they choose to do the work that Jake does because it does not fit. It does not fit in the systems and the access that has been designed. And so it just came to my mind. I needed to share that. But back to your question, the way we do the work at A Call to Men, to engage men on this journey of healthy masculinity. We do a lot of calling in versus calling out. That's really important to us. And I had seen Rich and other folks was engaging in the chat around how men do what we do, and what we do is very transactional. With A Call to Men, we try to move from transactional to transformational. We believe transformational is what's long lasting with men. While we understand there's a long road from the head to the heart, our job is, at the end of the day, to reach in and grab the hearts of men. That's where we believe the lasting change really happens. You also have to meet men where they are. So for us, there's no big I's and little U's. You'll never hear us at A Call to Men define ourselves as experts in anything. We're just men on a journey and asking you if you'll join us. And we have some good information that we'd like to share with you. We're also very intentional in sharing most of what I know. Most of what I'm talking to you about, I learned from women. And it might sound kind of awkward that as a man, I learned so much about what it means to really be a man, the nuances of it. I learned it from women because as men on our journey, we just kind of on remote control, just doing what's been passed on. It's women that bring the intentionality to the conversation and help us to think deeper around what it truly means in our society to be a man. So it's important to meet men where they're at and help them along this journey. We're also at a time where it's really important to address the pathology of men, understanding that hurt people hurt other people, understanding intersectionality and what that means from one cultural group to another. There are nuances and things that are different. It's also important for us in working with men who have caused harm. While we still have to address what you did, we also, in many cases, need to address what happened to you, right? And I've learned that mostly from Black and brown women who have an investment, a larger investment, with no disrespect to other, a larger investment in what's happening to men in their communities, and then incorporating that into the work that we're already doing. So I'll stop there.
Thank you so much, Tony. I absolutely agree with your first point as well. Why is care work one of the lowest paid works when mental health is possibly the most important thing to a human being besides physical health, but mental health is physical health as well. And so much of the care work really transforms humanity. So that's essential to society moving, to the universe really progressing. That's so important. And thank you also for mentioning to meet men where they are, and that hurt people do hurt people. It's good to see that you do take into account the intersectional factors of the men that come into your groups, into your projects, and you really try to work with them on it, which the same for Men Like Me, our program, where we try to pair our facilitators with the men from the same background so that they're able to culturally understand the challenges that they go through, especially with settlement, employment challenges. There's so many different issues when really settling into a new country for the first time. So it's really also meeting men where they are. Farah?
Yeah, it's picking up where about meeting men where they are, you know, Tony, I could listen to you forever. So thank you for just like setting the tone around this question, um, and really naming that piece about the devaluation of care work from invisible labor. And I would say visible too. Like we can see, like you can see who's in the hospital taking care of folks. You can see who's doing, you know, care in terms of babysitting. It was really interesting. There was a report done by Girl Guides of Canada about the gender pay gap that girls experience in like high school, early grade school, and all about babysitting and how they're paid less. So, like, if a young man says, you know, let me shovel your driveway, your snow, and you can pay me a little bit, they're paid more than a young girl is paid for babysitting. And so that was really interesting to me. So, how we see it from a young age. Right now, I'm leading a project called High School 2, where we are looking specifically at sexual assault and gender-based violence in high schools and looking at public policy and procedures around it. And it has been really interesting to go into spaces with students and young men. And you know, I've been doing work with, you know, young men, talking to them, varsity athletes, to the Raptors, like different people around this. But it's always interesting when you come into spaces with high school students right now, because of the rise of the manosphere, because of really public trials like Amber Heard and Johnny Depp. There's some real fear and trepidation about you coming in to attack them. So I really appreciate, Tony, you naming that piece around like how we have to come to a place of like calling in, not calling out. I think there is that. And I also think there are some things that do need to be called out. And the really rampant misogyny that is happening right now. And, you know, there's research that is showing that teachers are really struggling. I know White Ribbon is here, and they did a really great report that I was reading about this piece about teachers struggling with what to do when they're experiencing higher rates of misogyny directed towards them. So this project that we're doing, you know, I was so interesting. I was talking to one of the young men, and we were talking about restraining orders, because right now young women, if they're in dating violence, cannot get a restraining order because it's in family law, and so young women cannot, and that's something we're working on. And so he was like, well, you know, I don't want to get falsely accused. And I said, yeah, I hear that. Like that is a real fear that a lot of men have. And you know, I'm not going to shut him down around that. And I think that's the thing. We don't want to shut down young men. But what we want to do then, and the next part of that I said to him is, you're more likely to be harmed as a child or as a young adult, like sexually violated, than you are to be falsely accused. And that was a really hard one. Because the thing is, we don't talk about child sexual abuse. We go straight with young people. We tell them that their bodies are secrets when they're children. Don't know about your body parts. That's a problem. And then when you're a teenager, it's this scared straight information around sex and relationships. So we teach it from a very much of like, don't get pregnant, use a condom, and don't rape anybody. We don't talk about pleasure. We don't talk about sexual communication. Jake was there. I did a training with Jake in Timmins, Ontario, and I had the adults line up and a couple of adults who volunteered. And I said, you know, how do you check in? And they were so taken aback that they, as adults, had to name that. We have to go beyond what we're teaching, and we have to not teach children that their bodies are secrets. We have to teach them that their bodies are theirs, and there's body parts that they can name. We have to talk about the rampant amount of child sexual abuse in this country and across the world. And that sets the tone for young men, especially, to not want to talk about this, to feel unsafe in this conversation, to already have so much pain that by the time that they're 12 or 13, they don't know what to do with it. To have witnessed their mom or to witness themselves being harmed. So I think there's a huge amount of work that we need to do. We need to also create comprehensive sexual health education that is built on pleasure, that is built on communication, that is built on relationships of equity. And that is about care. Care is also consent. Consent and care are like best friends in my mind, you know? And so having that is really important. And then I think also, if we're talking about care and we're talking about ending this, part of that is also adultism, this idea that young people don't know what they need, that young people are not creators of change already, that, we're mentoring them, they're mentoring us. And we really need to do better than just worry about the manosphere and not think about the ways that they're already intervening in ways that we don't even know are possible. Because they're science fiction, right? Young people are science fiction to us. They're creating worlds that we've never seen before. And thank goodness they are.
Thanks so much, Farah. I do believe that everyone should really be aware of their own body and autonomy because it's important to be educated, right? You need to know yourself, your body, and um, you need to understand the impacts too of possible things that might happen. So it's really great that you brought that up. Jake, I wanted to also hear from you since you definitely come from a programmatic background about what approaches have been most effective in engaging men and boys in violence prevention and what cultural and community contexts shape the work that you do.
First of all, I just want to give a shout out to Farah. Witnessing her work in a room, I'm like, man, I wish she was my sex ed teacher. Just making it so real and like could have moved me so much further ahead so much sooner. Um, and I also want to talk a little bit about what Tony was talking about there for guys that look like me. And what we're finding works like, I'm a cis, white, hetero, tall, bald male, a lot of power and privilege in that sense. And what we are, at least what I'm trying to do is really highlight to them this system, this culture doesn't just suck for other people. It sucks for you simultaneously at the same time, right? And the same system and culture that diminishes caregiving wages, overrepresents men in positions of leadership, and all these types of things. In that same culture and system, men are 3 out of 4 suicides. Men die on average 4 to 5 years earlier than women. Men are the primary perpetrators of all forms of violence, and aside from cross-gender violence, they're the number one victims of other forms of violence at the hands of other men. And so, how do we take a stand for ourselves, even looking the way that I do, and say, hey, enough, this sucks, and build solidarity with others who don't have the privilege in the systems and structures that we exist within as well too. And so for us, it's that language of meet people where they're at sometimes can be a little bit of a throwaway in our space. But we've been running a Discord server for 6 years now, originally caused by the pandemic. We just took what we did offline, put it online on Zoom. It sucked. We hated it, and we asked the young people. We said, hey, we still want to support you during this time. What do we do? And they said, we're on Discord. And so, right now there's a lot of messages around kind of the manosphere, social media bans, all these types of things. These are awful places. Nobody should be on them. I agree in a lot of ways, but that's not always an option. So, how do we also go into those spaces and design them for care, connection, collaboration? One young man said to us that our Discord server is the safest place for boys on the internet. Safe, boys, and internet are 3 words you don't hear in one sentence very often. And so, how do we take these skills and do that? And there's no way we could ever run a 10,000 person Discord server. We need more community organizations setting up these kind of places and spaces and designing, imbuing them with that kind of DNA so that they can pick that up, that, hey, not all of online has to be bad. How do we have some good within that space as well too? And then the other thing I'll say is, like, what works in a Discord server with teenage boys looks very different than what looks like in a locker room, what looks like on a construction site in rural Saskatchewan. I think what's difficult about the sector and the space that we always find ourselves in is it's often programs for problems, and we just try to do the same thing in a bunch of different spaces. And we need efficacy and fidelity and all those types of things, but we also need facilitator capacity to read the room and honor this work and meet people where they're at. and often just really encouraging people for that peer influence. You don't need some outsider coming in. How do we make sure that people are setting their micro communities, their micro friend groups, as places of transformation and change? That's where it begins as well too.
Thank you, Jake. I also love that you incorporated Discord because, again, you're meeting them where they are, which is in these Discord group chats. And that's where so much talking goes on for young boys. So thank you for one of the strategies that you use to engage young boys. Yusra?
Thanks. I think a lot has been said about how to, calling in or calling out. I think it's about the funding and the way programs are structured as well, right? Because if we want to prevent and end GBV, we can't be, it can't be just do crisis response or do or not do one thing. So it has to be prevention and crisis response and wraparound supports. And that system kind of allows space for supporting the victims, while also making sure that we are making families stronger and we are investing in prevention. So a lot of what I'm hearing, I think the funding sometimes patchy and blotchy, and you do the work and then the funding isn't there, and then you do it again and then the funding goes away, and then you have to throw more money at it to bring it to the level where it was before. So I think consistent support and resources required to sustain those supports, that's very important. That would work. In terms of what would work, I read an interesting comment in the chat where which said that men care, but it shows up differently. But and something that I've seen in my work and in my personal life also is that sometimes the jargon and the terminology really causes disengagement. So making caregiving concrete and speaking instead of in abstract terms, but in really clear ways of, who wakes up with the baby, who knows the school schedule, can you be that who? And how can we share some of the concrete, explicit, tangible things that need to be done that would help ease some of the pressure off? That's very important. So I think language and being explicit and really cutting through the jargon, that's super important. And that's the way the conversations become real, because contexts are different, household to household, community to community. There's evidence that fathers are a deeply underused resource in child development, and there's systematic evidence that parenting supports, which are well designed, they can improve not just parenting practices, but reduce violence at the family level. So I think there's a lot of theory and a lot of research and data and models and pilots around it, but really putting it to practice in consistent ways is important. The last piece I'll say is that cultural and community context is very, very, very important, because if we're going to use approaches or run interventions that ignore language, migration histories, racism, colonization, faith, labor precarity, or intergenerational trauma, they're not going to work. So I often think, like, what's this magic button? Like, where is it that we can press? Because men can be engaged, and that determines the success of prevention interventions. But at the same time, sometimes it seems like there's so many hoops to jump through, whether it be sustained funding or it be outreach in community, or it be what approach to use with which group, and the needs on the ground keep evolving constantly. So I think the point is to translate all interventions with cultural fluency, and that there's a lot of good practice around it. So if the formula, if there is one, I'd say it is trusted messengers, sustained engagement, practical caregiving shifts, emotional literacy, and accountability that comes from community ownership, not through a project or a funder or a staff member that's working with you.
Thanks, Yusra. I think this also really answers the third question, which I had was what policy, workplace, or institutional shifts would be most transformative in normalizing shared caregiving responsibilities and strengthening the prevention of gender-based violence. So you had mentioned just having that cultural context, translating that cultural context within the programmatic work that we do. What about you, Farah? How do you think about the policy, workplace, and institutional shifts?
There's so much. I think I think about women with disabilities a lot as someone with disabilities myself. Just like a part of this caregiving, we know that women with disabilities people with disabilities are more likely to be harmed in relationships. And so when we talk about caregiving, understanding that piece in the workplace and having more flexible workplaces, I know there's a lot of push for people to get back in the office. The people that really appreciated not having to go into the office, a lot of us were people with disabilities, the ability to have a more flexible work schedule. So we've been thinking about from work policies around supporting women with disabilities, that's actually a violence prevention piece. It's increasing what we give to people. It's having, the basic income. I wonder what world we would have right now if we had basic income for everybody. If we had that, would people be in positions where they had to stay in a relationship? One of the most heartbreaking reports I've ever read was Walking on Eggshells, and it was about the changes to Ontario Works. And they talked about the fact that women said, I would rather stay with my abusive partner than go on Ontario Works because it's less controlling. It's less and that tells you so much. So we have a lot of policy pieces around economically. The more we create spaces where people feel safe to access their workplace that is flexible, that we understand around disability, that we understand around caregiving, yes, investing in caregivers because they will invest in us, that we are moving to a society where so many people will have disabilities, including women, and they will stay in relationships because there's no other way out. We need to change that. So workplaces have responsibilities, employers have responsibilities, and our government does around policies around caregiving. And last, I would say the last parts of policies I will always push is comprehensive sexual health education. If those policies, needs to meet the needs of the community.
Thank you so much, Farah. We recently did a dialogue series too with West Coast Leaf about the intersectionalities of the family policing system, which is also the child welfare system and gender-based violence. And we did find that a lot of people advocated for more caregiving for the caregivers because there's so much intense burnout. So that really resonated with what we talked about in that group. Tony?
In respect to policies, I don't want to regurgitate what the sisters all just shared. I will just add to it that in many of our workplaces, we have policies, right? We have child care benefits, we have hybrid schedules, we have paternity leave, which used to just be maternity leave. Now it's paternity leave. So, both partners can, take time off. We have all of that. And we also have a culture in many workplaces that say, yeah, we have that written, but you better be careful if you use it, right? We have people who still have the hiring privileges that will make a determination on whether to hire you or not based on whether or not we believe you're going to have children soon and how many of you are going to have. And I cannot hire you and hire the next person with that in mind, and no one knows but me. All right, so as long as we live in societies where profit and loss, capitalist societies where profit and loss completely trump humanity, we're going to still have these challenges. But it makes me go back to raising children, generation to generation, male-dominated societies. And if we're raising boys to have empathy, right? We're raising boys that have tolerance, patience, raising boys to love people, to embrace humanity, we have a better chance of flipping some of these systems around that have all the policies in play. All the policies are there, but there's still that culture that says, yeah, but if you use it, you better watch it, right? If you have one child, don't have another one a year or two later, not on this job. You're not going to be on paternity leave on this job twice in 4 years. All of that is still in play. And that's the stuff that we still have to challenge because the policies in many respects are there. It's that informal culture within organizations, that hidden culture within organizations that remains very much a sticking point.
Thank you so much, Tony. It is a shift in the culture that we need. And like you said, a lot of the policies are in place, but people might feel embarrassed to take paternity leave. Their coworkers might have something to say about that as well. And that's something that needs to change because we need both involved parents, whether that be a mom, a dad, two moms, two dads, they all need that time off to caregive. And that really does also start with encouraging young boys to think about these things. Thank you. Jake?
Oh, I'm really struggling to say anything intelligent after both of those. Just to bolster Tony's point as well, too, some of the most progressive societies that we often turn to around this type of stuff, the Scandinavian countries, there's a culture in Denmark where the men will bake apology cakes to their colleagues when they're going on parental leave. So they're going on parental leave, yay, but they're feeling like, oh, we're leaving you behind. I have to apologize for this, those types of things, right? And so that culture shift still has to lead that policy in a lot of ways. And Tony's sitting from the USA, where like on a federal state level, there's not a lot of parental leave in that way. And Farah's suggestions are imminently practical, and we should implement them right away. And I'm just left here thinking, how do we almost like if we really want to think of a policy like mandate that both parents take 6 months off and institutionalize from a young age that caregiving piece, but now we're also in a sandwich generation. How do we implement elder care into that as well too? And a lot of the corporates that we work with, we're often encouraging folks like what you can say, oh, I support my team, my staff taking time off doing this, but if they never see you doing it, that implicit to get ahead, to be the boss, to be the manager, you don't take that time away. It's still so much there. So just a big plus one to Farah and Tony's comments.
Thanks so much, Jake. I also love the apology cake story, the same as Amy Robichaud, CEO. That's wonderful to hear because again, is that community piece that we need to really support um, parenthood. And user, I know you answered the question already, but feel free to add on if you'd like to.
I just want to talk about hardcore numbers because these days, it's very prudent to do that. The globally based on macroeconomic analysis, GBV costs the world $5 trillion annually. So $5 trillion annually, that's the cost, while prevention, investments in prevention across 130 countries between 2020 and 2030, 10 years, it was $42 billion. So you can see how these are UNFPA numbers from a few years ago, but you can see the contrast really, like it's a clear gap between what violence costs us and what we invest to prevent it. If I come down and look at Canadian statistics, so Canada spent just in 2009 $7.4 billion just in that 1 year, and these statistics were reported in 2012 by Justice Canada. And Canada's federal investment, not provincial, not regional, but federal investments in GBV are in the hundreds of millions. So it's 820 million since 2017. So again, a sharp contrast. And what that tells me is that we're paying for the consequences of inequality and GBV, and we're paying in the most expensive and least effective way. So, parental leave in Canada, we have the right legislation, the policies are in place, but we're doing better. But in 2023 to 2024, only 30% of parental benefit claims were made by men. I think there needs to be something that embeds care into institutions, right? So if schools were teaching boys emotional literacy and relationship building skills, or health and social services were also supporting fathers as caregivers, not just mothers, because when I look at different programs, they're very like, are these for men? Are these for women? I think the change has to come from there as well. Same with settlement and community services. We don't engage men around care, belonging, and accountability. So I'm going to end by saying that sometimes, when we're thinking about men and women, I was like, who are these men, right? Like I have two boys aged 10 and 12. These are the men, or my husband who his mom sees just the way I see my little kids. Like, is he the man? Like, who are these men, right? So I think it's weird, I'm struggling to articulate it, but it's this division and this it's further complicated because it's crazy o'clock in the world everywhere. I think there needs to be there's so much overlap, and I so agree with what Farah said about the comprehensive sexual reproductive health education. And I'd say in addition to Scandinavia, there's so many. I come from international development, some work at the UN. There's so many communal models on the ground in the global south as well. Like there's so much to learn and be inspired from. So I'll end at that, and thank you. It's been such an amazing conversation.
Thank you, Yusra. What a powerful message that we really need to start at prevention because it is cost effective, way more cost effective than the aftermath. And thank you, everyone from the first panel, for joining us today. We've really learned that what we need is to breed a culture of nurturing, meeting men where they are, involved fatherhood, consistent support and resources, and investing in caregivers and recognizing the invisible labor that goes behind the scenes. And I will now pass it on to Amy Robichaud for a re-welcoming for the second panel. Thank you, everyone.